welcome listeners to another episode of the Rick and Danny Show. Danny, we have another special guest. We are racking them up these last couple episodes. Pretty exciting.
It is exciting. Happy to have her.
And piggybacking slightly off of Dr. Kuthiala's episode about the new imaging center we have there at her office, we decided to bring on our imaging manager, a jack of all trades who helps keep us in line when it comes to the ever-expanding imaging network we have at Cancer Specialists in North Florida.
I don't know if you can give me that much credit, Dr. Cassidy, but thank you guys for having me on today.
Welcome, Leah. Happy to have you here.
Thank you, Leah, for joining us.
Yeah.
So, Leah, can you give the listeners a little bit of, your background and how you ended up at Cancer Specialists?
Of course. I originally started in radiology, very basics, X-ray. Went on to realize that I wanted to do more. Went to nuclear medicine school at Salt Lake City University. And then I applied here at Cancer Specialists, my very first job. I've been here for now 10 years, and I've been manager for 2.5. So I'm glad to be here.
That's great. So we had a recent move, the Southside Clinic moved from their Booth location over to AC Skinner Parkway, and that was a big endeavor with a couple new machines, a PET-CT scanner and a MRI machine that is new to that location. Can you tell us a little bit more about that and how difficult that was during the move and how it is now?
Yeah, that was a pretty big move, probably the biggest one I think our company has had, but also the best move that we could make. I think the location was perfect. It's very central to all of our locations throughout Jacksonville, so it made it easier to have both an in-house MR and CT, PET-CT. It's easier for patients to travel to. It just made sense to pick this location. For the most part, this was a big move. It's our first in-house MR, very advanced. AI is integrated into the system, so it makes it to where you can have specialized protocols. You pick that protocol, and it already knows where to set the patient up in the machine. Less time for the patient to lay on the machine, so more comfort, more safety reasons, also for patients that are claustrophobic. Their patients so far have been very pleased with this MR machine. We've also, like I said, specialized protocols, as Dr. Cassidy knows, especially with radiation. We have radiation-built protocols for certain organs, for certain cancers, things like that. And so this one is a lot easier to build. And like I said, faster scan times. For PET-CT, for the most part, way less dosage, so less radiation exposure to the patient. I think right now we're doing 12 millicuries. We can do at least up to 8 millicuries now, so almost cutting it in half for the most part, and also less table time for the patient, so faster scan times, better comfort, things like that. So for our PET-CT scans, what we do is we inject a certain isotope into the patient by IV. The millicuries is the actual amount of radiation that we're administering to the patient. And so right now our protocol is 12 millicuries for all of our other machines. And we can cut that almost in half. Like I said, I think 8 is our max that we give the patient. And so that allows the patient, the radiation to absorb in the patient's body. And it shows us where any cancer may be on the scan.
Yeah, huge advantage not to expose patients to more radiation than they need to for a particular scan, because these scans are things that we do sometimes once, but sometimes multiple times. And, I think that's a huge bonus that, we have at our new location, to be able to say that, we're exposing you to much less radiation than older scans or scans in other areas of town. And I'm happy to hear about the MRI. Times under, people worry about the claustrophobia. The time to scan is much better and patients are much more comfortable. I think that's huge to be able to tell patients that their experience is going to be much more comfortable.
Yeah, we actually just had a patient this week say that, sometimes unfortunately patients have to take medication to get through an MRI.
Mm-hmm.
And he said he does not see that happening anymore, that it was cut down by 50%, like up to 15 minutes is how much we do a brain now. And
Wow.
he was like, I can definitely make that work. So that was great to hear.
No, for someone who's had an MRI before, I would love for it to be shorter.
I think
Me
anyone
too.
who's had an MRI definitely knows it's not for the faint of heart, let alone a brain MRI where you're in the masks and other things where it's extremely claustrophobic. Even for someone who's not predisposed to it, it can be a
Right.
challenge.
Yes, and
So no,
extremely uncomfortable sometimes.
yeah, and
Yeah.
I feel bad as a person on the radiation side. We order, I would say, the majority or the bulk of the MRIs in the practice. So we're constantly dealing with, trying to find ways to make it better for the patients, easier for the patients, and certainly the best way to do it is to have a better machine, a better facility to do it. So it's definitely been a blessing so far on that front.
Yes, it's definitely a one-stop shop for imaging patients, and I think they like the comfort also of being able to combine scans.
Hmm.
And so you come and you can get a PET or an MR or whatever you need that day instead of making multiple trips. So that's another advantage to the site.
Leah, I think one of the other things that's been nice about, and I touched it up on the last episode with Dr. Kuthial, but how has now, I mean, I know it's been just a month, but how has it freed up the schedule of our other imaging centers, both our fixed units at some of the other sites as well as our mobile units? And, have you seen greater patient satisfaction and convenience for scheduling?
Oh, it's been amazing. We've been able to maximize the current schedule. So we've been able to give practices that were having one day every other week now 2 additional days. It's more convenience for the patients. We're being able to keep more patients in house rather than sending them external because obviously their patient care comes first, and so we don't want to be able to or have to delay their scan. I keep a very close track on our schedules as far as are we maximizing the amount of slots that we have? Are we making sure that the patients come first? What can we do to make the schedules more convenient for the patients? And so far, it's been amazing to be able to offer those additional days to our other sites.
And how late do you schedule out PET CTs and MRIs? How late in the day do you schedule?
It all just depends on the exam that we schedule at the end of the day. Right now, for MR, it stops at 3 o'clock. It also depends on the site and the machine. So for Southside, we could do a 3:30 MR because it would only take 15 minutes. A lot of our coverage ends at 4 o'clock. So for contrast, safety reasons, things like that. If we were at our Fleming Island location, I think our radiation physicians sometimes are there a little later. So it all just depends. It's site specific. So
Yeah, I think we've brought that up before as a group to see about extending hours. It's been discussed before, patient convenience, that's some patients work later, can only come after their work hours or even on the weekends. We are discussing options in the future, and I know you've probably been in discussions too about that.
yeah, I definitely have the technologists that would love to work 410s or a Saturday or whatever the case may be. I'm definitely thankful for the group I have. They're very patient oriented. So
Yeah.
they'll do whatever they need to do.
Yeah, I think being able to have an open mind and really, doing these things to be more convenient to the patient's needs. So,
And I think the other thing too, that's, we talked about it in the years ago in one of the episodes, but it's true is because we're involved with the protocols and the communication with Leah and her team, we really make sure that when a patient gets a scan with us, we can be very confident that we're getting not only the scan we want, but the specific sequences, the specific thicknesses, and all these different things that, are very important for clinical care. But if someone is coming up with these protocols, is not involved with the clinical care, or if the clinician or the provider has no influence on that, then sometimes, unfortunately, it's not a fault of anyone. But, if someone has a scan done at another facility, maybe it's the same quote unquote order, but it may not have the specific things that we need for treatment planning from the radiation side, or it may not be the specific things that we need for certain types of tumors. So it's, I think it's, as a clinician, it's a blessing to have, an in-house team who's willing to work with us, be patient with us while we come up and kind of fine tune these things so that when our patients get the scans, we can be confident they're getting sort of the best bang for their buck in terms of monitoring their disease and that sort of thing.
Yeah. Yeah, I definitely agree. I think that is one of the things that cancer specialist stands out from the other outpatient imaging centers is we focus on our patients and the specialized protocols. And we work so closely with our medical oncologists and our radiation oncologists and even our radiologists. We work together as a team and a whole to see what we need to do to be able to look at the patient as a whole and not just as another person. So it's sometimes can be diagnosis. It could be, radiation planning reasons. I think that's just one thing that makes us stand out.
Yeah, and I'm thrilled with not having to tell patients we're waiting weeks to get their result from the MRI, from a CT scan, that our radiologists are reading them pretty promptly within a day or two.
Mm-hmm.
And we can pull up those images with the patients when we see them back in clinic. I always do that with my patients. I know Rick does, pulls up the image, be able to kind of see what the radiologist read and kind of talk it over with the patient in real time with the image pulled up. I think that's extremely helpful to where, in the past we've had to reschedule patients due to delayed radiology reads, but I'm really happy with our current setup. It's really advantageous.
Me too. They're very easy to communicate with. If there is an issue, a delay, we reach out and we automatically get a response back. If we need to work with them about, approving different protocols, and they're very understanding as far as like our patients being oncology patients. I think the group that we have now is a great fit for us.
What are some of the things you're looking forward to in terms of growth with the imaging department in the next few years?
I think the answer always is more in-house machines. I know Dr. Mosey would love for us to get an MR and a PET CT in Fleming Island. And I think that's another thing big on my to-do list. But yeah, just, better, more advanced machines, better comfort for the patients, more scheduling flexibility, things like that.
Yeah, agreed. I mean, we have no fixed machines out here at the beach just because of the current office setup, obviously. But even when the mobile unit is here, we just have so much positive feedback that, a lot of patients can literally walk over here and get their CT or PET CT done, which they're thrilled about.
Yes. And
So
I think
that option is great.
Yeah, I do. I mean, there are disadvantages to the mobile pets, but I think the main advantage is to be able to come to the patient, to offer that comfort for them where they don't have to travel all throughout Jacksonville. And so that's one thing that I always harp on is, we do this for the patient. So
yeah, and a familiar check-in process too. They're not going to some, foreign, location where, they're not familiar with the check-in process, how long they're going to have to wait. They come here to clinic, they're used to checking in with our front desk. They already know the people. We're going to get them in and out quickly.
Yeah, it makes for a less stressful environment, a less stressful appointment.
Definitely. Well, thank you so much, Leah, for being with us and telling us all about the imaging department and some of the new machines and just new technology we have at CSNF. Thank you for leading the department. You've done a great job.
Thank you guys for having me today.
Yep, we're very lucky to have you, and thanks for taking the time to join us.
Thanks, guys.